As we talk about the Cox triangle, you will see that since it's a triangle, we'll have three sides and we have to chalk out what are the three components. There's one question which is asking us about the Cox triangle. Actually, these are very frequently coming questions these days. So, what is not a boundary? What do you think could be the answer? You will see that there is a tendon of Todaro contributing, which is some collagen fibers attaching to fibrous tissue of the heart. And there is also coronary sinus ostium, which is related, and septal cusp of tricuspid valve, but not the inferior vena cava. So, as you can make out, this is not a boundary, so that should be the answer. Let us talk about the other three then. You will find that we have opened the right atrium once again, and this is the rough tabulated portion of the right atrium, that is the smooth posterior wall of right atrium showing the fossa ovalis there. This is what we call as Cox triangle. And what are the boundaries? You see here is the tendon of Todaro, and this is the opening of coronary sinus at the base, and this is the septal cusp of the tricuspid valve. In fact, there is this tricuspid valve which is also called as right atrioventricular valve, because the blood of the right atrium was supposed to go to the right ventricle passing the tricuspid valve here. It is having three cusps, and one of the cusps here is called septal cusp of tricuspid valve. That is the relation. Importance of Cox triangle is that we got this AV node at the apex of the Cox triangle. If you say AV node is at the apex of the Cox triangle there, what is at the base? Base was the opening of coronary sinus. And what about the inferior vena cava? See, this is the inferior vena cava. And maybe it is close by, but it is not the relation of the Cox triangle boundary. And what about the limbus fossa ovalis? That also comes as a question. Maybe limbus fossa ovalis is near the Cox triangle, but it is not the boundary. So you just have to know the boundaries of the Cox triangle there. Yes, that's the point, but it is not over. We have to go further with that. If you have opened up the heart in a dissected specimen, then you can again see this is the tendon of Todaro. It is actually some collagen fibers which are subendocardial. Means there's endocardium covering the interior of the heart, yes, and it is below the endocardium. Yes, it is subendocardial collagen fibers. And where is it going? Actually, it is forming one of the boundaries, and then you will see this is the opening of coronary sinus. If you say that is the opening of coronary sinus from the posterior aspect of the heart, then this is the tricuspid valve here. Yeah, that is the tricuspid valve where the blood of the right atrium is supposed to go to the right ventricle. But that is where we have this boundary, and we are talking about the septal cusp of tricuspid valve there. Now you can see this is the fossa ovalis, and there is limbus fossa ovalis, and they are not at all related to the Cox triangle. As you move further, there are other questions asking the details. We have to magnify this area. Actually, this is the superior vena cava there, opening of inferior vena cava down there, and then you have the fossa ovalis. This is the opening of coronary sinus. This is the septal cusp of tricuspid valve. Let us magnify. Understand that this is the fossa ovalis for orientation. That is limbus fossa ovalis for orientation. This is the tendon of Todaro. Now the thing is, tendon of Todaro is connected to this central fibrous body. What is central fibrous body? You know, there is a fibrous skeleton of the heart. It is one of the components of the fibrous skeleton of the heart. So, fibrous skeleton of heart, you have some central fibrous body. Yes, that is where is attachment of the tendon of Todaro, and that is where also is the attachment of the septal cusp of tricuspid valve. So that is a septal cusp of tricuspid valve. Yes. And then you had this inferior boundary, which is opening of the coronary sinus base. So base is the coronary sinus. What is the apex? Apex is AV node. And what is this EV? EV is the eustachian valve, which is the valve to, in the fetus, embryological valve for the inferior vena cava opening. So inferior vena cava is guarded by a valve, eustachian valve, in the embryological situation, but in the adult it is non-functional. So these are some of the things which we wanted to know. This is the diagram which we are supposed to draw. As you draw this diagram, there will be a tendon of Todaro. Yes. And base is some coronary sinus opening. Yes. And this is the septal cusp of tricuspid valve. Yes, that is the point here. So this is going to be the tendon of Todaro. Where is it attaching? Central fibrous body. And to the central fibrous body is also attaching the septal cusp of tricuspid valve. And what is at the apex? At the apex, what we have got is the AV node. If you say that is AV node, what is the importance of knowing all that? Importance is, I have a case of AV nodal re-entry tachycardia. What is that? AV nodal re-entry tachycardia. So you got a case of AV nodal re-entry tachycardia. Why? Because there is PSVT. What is PSVT? Paroxysmal supraventricular tachycardia. Now, when you got a case of paroxysmal supraventricular tachycardia and it is AV nodal re-entry tachycardia, what are you supposed to do? I will manage the emergency with some injecting some drugs and giving some oral drugs, but I will post this patient for radio frequency ablation. Radio frequency ablation of what? Radio frequency ablation of the Cox triangle. I will destroy the Cox triangle. What will happen if you destroy the Cox triangle? Then I'll destroy the AV node. Then what will happen? See, why there was tachycardia? Due to some re-entry at the level of AV node. So, if I remove the AV node, destroy the AV node, then I will have a symptomatic relief in the patient. So, in this case, as you have radiofrequency ablation of Cox triangle, you will actually destroy the AV node, which is a content, and there will be symptomatic relief from that problem, tachycardia problem. This is the importance of Cox triangle. Now, there is a question on supraventricular crest. Let us look at the details. You remember we have discussed that there is inlet and outlet for the ventricles, and the outlet will be smooth outflow. Inlet is rough. So there is rough part of the ventricles and the smooth part of the ventricles. What was their embryology? You remember? A rough trabeculated portion of the ventricles. You will see the diagram and tell me again. See, there is a supraventricular crest which is actually between the inflow and outflow of the right ventricle. And what is the inflow? Inflow, like, this is the inflow of the right ventricle, and it is having these pectinate muscles, and it is rough trabeculated portion. If you're telling that this is the rough and trabeculated portion, I think this would have come from the primitive ventricle. Yes, it would have come from the primitive ventricle, right, embryologically. Then who would have formed the smooth outflow tract? The smooth outflow tract would have been formed by the bulbous cordage, and between the two, you have this supraventricular crest. The blood will enter the ventricle and then it will exit the pulmonary trunk. Are you talking about conus arteriosus here? Yes, conus arteriosus, smooth part of the right ventricle. So smooth part of the right ventricle, conus arteriosus, towards this pulmonary trunk, the tricuspid valve there. Yeah, pulmonary valve is also tricuspid valve there. So this right AV valve is also tricuspid. Yes, that is also tricuspid valve. What is this? This is the papillary muscle. If you say this is the papillary muscle, what is this papillary muscle attaching to? Actually, papillary muscle is in the rough trabecular portion of the ventricle. And what is it attaching to? It is having some chordae tendineae. And what is that chordae tendineae attaching to? To the cusp here, because you know that there is this cusp, tricuspid valve here. So this is tricuspid valve having cusp, yes, and you are trying to control the cusp by some chordae tendineae. Yes, they are tendinous chordae tendineae, and this is papillary muscle, some papillary muscle in the rough trabecular portion. Yes, so these are some details which you should be aware of. So that was the supraventricular tachycardia in the right ventricle. Yes, it is junction of the rough inflow and smooth outflow of the right ventricle.